WHO has used this definition in the context of health, and we as practitioners of medicine are really connected with treating people with disease. So curing people from an illness becomes our primary motive, and that is what we have been learning all along. Gradually, as non-communicative illnesses have come to the fore, we have started discovering the value of preventive health or preventive medicine. But then it is still looking at ways and means of not allowing us to slide into ill health or disease. We are still talking of disease as a centering. But when WHO speaks of health and the aspect of spirituality as pertaining to health, there are three levels at which spirituality is utilized. And all the three are well-established principles in psychology and philosophy. The first is that how do we achieve integration between different levels of the human being, the physical, the mental, the emotional. How do we make connections in all the three so that we as individuals come across as whole human beings? So we don't think something which we don't feel, and we don't behave, or our bodies don't act in a way which is out of touch with our thoughts and our emotions. So that is a level at which the individual is getting connected in between herself or himself. The second level is at the level of connecting with the community, and where we are able to establish our linkages with each other, and where we discover that we are not alone in this world. We and our fellow human beings are connected to each other in a very deep way. And that is what quantum physics is also now bringing out in a very prominent way. And that what we do in our individual capacity has impact on others. And that is how the whole concept of pollution, environmental destruction, climate change is getting linked to these connections between human beings, and that is what we would consider as a spiritual connection. And the third is what our mystic philosophers have defined as a connection between us as a reality within ourselves and a higher reality which is pervading all the world, and where we are able to establish a connection, where we are able to perceive our role in this life, where certain philosophies talk of an afterlife and the connections between the two, and where we look at this life as only one instance where we transit into this life and transit out. So at these different levels, health can look at the concept of spirituality, and WHO will look at or will consider spirituality in this dimension, so that health of the individual, health of the community, health of the earth can be maintained and can be prolonged.